Hey, my name is Dr. Sean Price, Clinical Coordinator here at The Fix in Fort Walton Beach. In this video series, we're talking about what do you do when chiropractic doesn't work for you, when you have some kind of a pain issue or a headache issue or a lack of range of motion and chiropractic is not working for you. What do you do? Why did it not work for you? Does that mean that chiropractic doesn't work? And I'll give you the first answer to that, answer to that last question, which is chiropractic absolutely does work. Chiropractic is the art and science of removing subluxations from the spine. And there's no other art out there that is as effective at removing subluxations from the spine to allow the brain to get the signal to the body. Now that's where the problem comes in, is sometimes the brain can be functioning improperly, and we talked about that in the previous video. Sometimes metabolically the patient might have a disorder that doesn't allow for the function to recover because the body isn't metabolically sound enough to carry out the functions. The other thing that can happen is structural damage, and this is the one that I personally experienced. When I was 24 years old, I was sitting on a couch and I was playing tug-of-war with a chihuahua, and my back went out and I couldn't stand up. And for 8 months I received chiropractic adjustments, and my chiropractor was excellent. She's a local doctor here. I love her to death. She is an excellent chiropractor. But we could not get the situation to resolve. We finally ran an MRI and found that I had blown a disc in my back, so I had to have back surgery. So the point of this is sometimes there's structural damage, whether it's a bulging or a herniated disc, whether it is a osteophytes or degenerative joint disease, or there's some sort of a structural issue that could be causing the problem. And in a situation like that, a lot of the times people can recover. For example, patients with bulging discs, we get them better all the time chiropractically because we can take the pressure off the disc and allow it to heal. But sometimes it gets beyond the scope of what the adjustment alone can do. So we have a couple things that we can do for that. One of them is decompression therapy. And decompression therapy is a table that uses decompression to actually spread the space between the vertebrae to allow space for that disc to actually try to heal itself and try to reduce some pressure on the nerves. So this is a structural therapy that we didn't have when I was 24 years old and I had back surgery. This was not around. We have traction, which is totally different and a lot of times can cause even further injury versus decompression therapy. But we didn't have decompression back then. And I truly believe that if we had decompression therapy, I would not have had to have back surgery. So decompression therapy can help with those bulging discs. It can help with stenosis. It can help with degenerative joint disease where the vertebrae has gotten so low that you don't have space in there for the nerves anymore. Decompression can help with a lot of these things if there's a structural component that is beyond what chiropractic alone can do. But the key is you have to mix the decompression in there with the chiropractic aspect, because you've got to restore that normal function to those vertebrae. You've got to make sure that that subluxation is gone when you're making sure you open the space up for that. So decompression therapy is another adjunct that you can use to get through those complicated cases, again without drugs and without surgery. Please feel free to ask any questions below. Like us on Facebook and subscribe to our channel on YouTube, and give us a call at the office if you'd like to chat about any of this. Okay?